Certain changes in texture, color, or more can indicate that there's something wrong with your tongue. The problem could be as simple as an ulcer, or it could be more complex. Let's take a look at what your tongue can tell you about your overall health. 1. Color changes. A healthy tongue can vary in color, between several lighter and darker shades of pink. That's fine, but the tongue can change from red, white, or yellow, which forms in patches, lines, or lumps. What does each color mean, and when should you be concerned? White tongue. Thick white patches or cottage cheese-like white coating on your tongue may indicate oral thrush, which creates white spots on the tongue and cheeks. People with weakened immune systems and toddlers could be at higher risk from oral thrush. White lines across the tongue could be a symptom of oral lichen planus. While this type of white tongue appearance can go away on its own, it's still wise to see your doctor. Red tongue. Similarly, a bright red tongue may be a sign of other health conditions such as certain vitamin deficiencies. A vitamin B12 or folic acid deficiency is particularly common. If the redness is caused by a vitamin deficiency, it should clear up when the deficiency is dealt with. Make sure you're getting plenty of B vitamins and folic acid in your daily diet. Kawasaki disease can cause a bright red tongue as well as other symptoms. This is a rare disease that can affect very young children. Scarlet fever causes redness along with large bumps on your tongue. Usually more serious diseases like scarlet fever and Kawasaki disease are accompanied by other symptoms, like a fever. If you think you may have Kawasaki disease, get it checked out as soon as possible. Yellow tongue. Discoloration can make your tongue yellow. Smokers' tongues can turn yellow, especially if a person chews tobacco. Psoriasis can cause yellowing. In extreme cases, jaundice can cause a yellowed tongue. If you're not sure whether the discoloration in your tongue is caused by your diet, if you've just eaten a meal, for example, or something else, clean your teeth and tongue thoroughly and see if that helps. Black tongue. A black and hairy tongue can be a bit of a shock. However, more often than not, a black tongue comes from a reasonably harmless cause. People with diabetes are more likely to have a blackened tongue, and chemotherapy and poor oral hygiene can also cause a tongue to have a blackened or hairy appearance. Of course, if you're concerned about a black, hairy tongue, it's always best to see your doctor. 2. Changes in texture. The first change in your tongue that you might notice is a sore, bumpy texture. A quick Google search might bring up terrifying articles about oral cancer and tumors. Before you panic, remember that most causes of a sore, bumpy texture on the tongue are quite simple and not cancer-related. Canker sores, burns, or accidental bites or tobacco use can all cause a sore, bumpy tongue. Usually, these issues are relatively normal and harmless and will clear up in a few weeks. For soreness or bumps that don't clear up within 2 weeks, visit a doctor. The cause is most likely benign, but it's good to check. 3. Swelling. A sudden swelling of the tongue could be a sign of an allergic reaction. If your tongue suddenly swells up, you should seek medical advice immediately, as this can result in difficulty breathing. The swelling may be accompanied by shortness of breath or swelling in the lips, mouth, throat, or hands. Strep throat, an overactive thyroid, or anemia can cause tongue swelling. More serious health issues such as tongue cancer, mouth cancer, or leukemia can cause the tongue to swell. A permanent swelling in your tongue, whether accompanied by other symptoms or not, such as pain or bumps on your tongue, should be checked out by a doctor. Chances are it's nothing, but if it's not normal, you'll want to set your mind at rest. 4. Painful tongue. More often than not, a painful tongue area or pain elsewhere in your mouth can be traced back to accidentally biting your tongue or the inside of your cheeks during dinner, eating or drinking something too hot, or a nasty little canker sore. A bite or some other form of irritation can give you a painful tongue for several days, depending on the extent of the injury. While some conditions like tongue cancer, oral cancer, or tumors may cause tongue discomfort, it can also be caused by something as simple as poorly fitted dentures or braces. Canker sores can be very painful and last for up to several weeks. While there are pain-relieving gels you can use, a canker sore should recede by itself. In the meantime, try and avoid hot, spicy, or irritating foods. Of course, if your discomfort lasts for more than a few weeks, You should see a doctor to rule out more serious causes. 5. Loss of taste. A loss of taste could be due to a mouth injury, especially a burn or recent injury or infection. Something as simple as a cold or virus could lead to a reduced sense of taste. A loss of taste could be related to an issue with the taste buds or even with the salivary glands. If a loss of taste lasts for more than a week or two or shows no signs of improvement, visit a doctor. 6. Unusual sensations. You may notice a burning, prickling, or numb sensation in your tongue. This could be due to an injury or an infection, but it may present along with other symptoms. For example, you may notice pain, swelling, or a lack of taste. Unusual sensations in the tongue are often connected with some of the other health issues we've mentioned. Damaged nerves and multiple sclerosis are conditions that can cause pain, burning, or other strange sensations in the tongue. However, these conditions are likely to be accompanied by some other symptoms. If you're concerned, speak to a doctor. It's worth noting a healthy tongue shouldn't be completely smooth. Our tongues are covered with taste buds, which may vary slightly in size and might be visible. A tongue should be a healthy pink color, free of discoloration, fissures, or other kinds of cracks or lumps. The edges should be smooth and rounded, and you should never experience pain or discomfort while you're eating. In fact, most of the time you should hardly be aware of your tongue at all. Remember also, tongue health and dental hygiene go hand in hand. Keeping your tongue healthy can be done by maintaining good dental hygiene. Good oral hygiene practices involve more than just cleaning teeth. In fact, missing the tongue out of your daily teeth cleaning routine is one of the leading causes of bad breath. Bacteria from tooth abscesses can move into the cheeks, gums, and tongue. When you brush your teeth, you should include tongue cleaning in your routine. There are several ways you can do this. The simplest way to clean your tongue while you brush your teeth is by using the toothbrush itself. Gently brush the surface of your tongue with the toothbrush, starting from the back and working forward. Be sure to be very gentle, as vigorously brushing the surface of your tongue with rough bristles can cause injury. Alternatively, scrubbers for tongues are available, and some toothbrushes have scrubbers built into the toothbrush head itself. Brushing your teeth twice a day for at least 2 minutes can greatly reduce the risk of infections. You might also want to consider a mouthwash to fully cleanse the inside of your mouth. If you're not sure, ask your dentist what they would recommend. I hope you've enjoyed this video. If you have, please subscribe to this YouTube channel, and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy our next video on what causes white tongue. Thanks for watching. Bye for now.